Dr. Shane here. We're going to go through how to breathe and brace and why to breathe and brace while doing activities like lifting or something as simple as sitting. So Jackie here, let's bring the knees up. The first thing that we want to do is learn how to breathe utilizing our diaphragm. So you're going to take your hands, go thumbs into the sides, fingers out front, and you're going to press in a little bit. This is going to give you feedback on where to breathe into. So you're going to deeply inhale and try to press the belly outwards. And then on the exhale, just let everything go. So a common mistake people have when bracing or just breathing in general, they think everything has to be belly pushing out. And essentially that's what we want to do, but it's more about the pressure that you're creating internally. So instead of just thinking push the belly out, think about increasing the pressure that you have, not only in your abdomen, but also in the chest. So most people are, we'll call them chest breathers or shallow breathers. When you're a shallow breather and you're only utilizing the breath in the chest, this is going to activate secondary breathing muscles, which are oftentimes in the neck, and this can cause neck tightness and lack of stability, which may lead to neck pain, low back pain, things like that. So that's step one. Inhale, expand. Exhale, let everything go. Step two is going to be the inhale, expand, creating pressure, but even on the exhale, you want to try to maintain that pressure. So inhale, increase that pressure. Exhale, maintain the pressure. On the subsequent inhale, you should not lose that pressure. You want to aim for about 5 breaths. The whole time during those 5 breaths, you want to maintain that expansion around the abdomen. And remember, it's not only expansion through the front of the abdomen, 360 degrees around, front, side, and back. That's why you're pushing in with the thumbs. That's why you're pushing in with the fingers. All right, it looks like Jackie has this down. So we're gonna move to step 3. This is where it gets a little tricky. This is where we have to add in the bracing component. So to brace the abdomen, we're gonna gently push the low back down into the table, almost like you're about to do a sit-up. So you're activating those core muscles, but you're gonna do this simultaneously while you do that breathing. So it's the inhale, expand, exhale, maintain that expansion, while you're pressing into the table. Now you're going to start to feel the abs engage. This is going to get a little bit difficult. Like anything, this takes practice and it takes time. So if you don't get this right away, it's okay. Just keep at it. With every inhale, you're thinking increase internal pressure. With every exhale, think about increasing bracing while maintaining that internal pressure. And then the key is between that exhale and the next inhale, you don't want to lose that pressure. So you want to aim for about 5 to 10 breaths of maintaining that pressure. If you've ever seen a power lifter or somebody squat a lot of weight or max out, what do? They get in their position, they take a deep breath in, and they squeeze, and they don't even breathe on that 1 rep. I call that 10 out of 10 bracing. We want to be able to accurately match our bracing to the activity that we're doing. So say if you're doing a bench press, pretty light, maybe you're going 15 reps, you do want to be braced, but you don't want 10 out of 10 bracing because that's going to be really hard to do for 15 reps. So you want to be at maybe a 5 or 6 out of 10 bracing. If you're just sitting down watching TV, do you want to be at a 0 out of 10? No, you don't. Because if you're at a 0 out of 10, there's nothing holding you up and you're going to be in this very relaxed position. So you want to aim for about a 1 or 2 out of 10, just enough bracing to where you're sitting upright, almost effortlessly, but still consciously maintaining just a little bit of bracing. How you doing? Good? Now, if Jackie doesn't quite get that mechanism of pushing outward, we would have her use a small light weight, and she could put that on the top of her abdomen like that. And you could just put your fingertips on the sides of the weight to make sure it doesn't fall. There you go, perfect. And then you want to think about with that inhale, pushing the weight up and out. And then on the exhale, holding it there. This is a good way to activate or have somebody learn to activate the diaphragm. But remember, it's more about internal pressure versus just pushing the belly out. So if you're not quite getting a huge expansion through the abdomen, that's okay, as long as you're still feeling this pressure internally. So the inhale, I call that the Buddha belly. So you're trying to get this big Buddha belly. On the exhale, you're trying to create a turtle shell. So a little bit of rounding, but firm. Double check on the sides, make sure the sides are firm. And you're good to go. All right, I think that's good. That was a little bit wordy, but